Thanks so much for joining us. Take it away.
Well, I am thrilled to be here. It is great to talk to all of you. And even though the semester has started, this question is still absolutely critical. Why does COVID-19 testing in schools still matter? And I'm looking forward to going through the presentation, but also taking your questions so we can have a discussion. And I will start and then hand it over to Karen. Super. Professor of practice of biomedical diagnostics at Arizona State. You could see in the bio and the materials, I sit on a number of boards, public company boards and private company. Most relevant to testing is I am on the board of OraSure Technologies that does have a COVID test, but I'm not going to speaking about any individual COVID tests, but rather the industry and testing more broadly today. So I'm going to talk about this agenda, and it's very similar to what I talked about last time, although last time it was the good, bad, and the ugly. Today, I'm going to be more positive and go to the good, bad, and the hopeful. It's a while before we're going to get to the good and just the hopeful. There is a little bit of bad. Then we're going to talk about COVID, school safety, some overlap with last time, but much of new that has happened. And then the school testing options. And then going over to Karen to talk about ready, check, go. So most importantly, and I'm going to spend a moment here to talk about the good, the bad, and the ugly. So I think as everyone recognized, when we spoke in July, Delta was only just starting and the numbers were looking just a bit like there was going to be a surge. Clearly, we know there was a large surge. And for most of the country as a whole, we got to almost 50% of the surge last winter, just after that marvelous period in May and June when we really thought this was over. Hospitalizations was actually even higher. Some areas higher than the last surge. And I'll talk a little bit about why and how. But the other part of the good, which I think is terrific, is that if you go with several different sources, but between 85 and 90% of US teachers are vaccinated. That is a tremendous number. The NEA talks about that. The Labor Association talks about it. That is teachers. For other staff in these schools, it tends to be lower, but still higher than the general public. Secondly, and highly relevant, is about 60% of teenagers are vaccinated today. Not surprising, we had a very large number vaccinated in the last few weeks. So that's the good. The bad is school testing is going slowly. I had really hoped and expected there'd be as many as 50% of schools testing. It's now about 20%. 30% or so of adults are not vaccinated. And what is really terrible, which 2 years ago, almost 2 years ago, I never imagined, is we have now surpassed the 1918 pandemic. Now, as a percent of our total population, it's lower. But gosh, wouldn't you have thought that with the medicines we have now, we could control a pandemic better than they were able to do literally more than 100 years ago. But we have to remember all the lessons we've learned. Why am I hopeful? Well, I think there are two really key things happening. One is vaccines for children are being reviewed on October 26th. You don't want to assume anything, but I am really optimistic that the Pfizer vaccine for young kids will be authorized for an EUA, and then soon after that for full approval. I do know they're already starting testing, or at least recruiting, for a vaccine for 6-month to 5-year-olds. My grandson is on the waiting list to get into one of those trials. So really optimistic that it will be available for everybody. And then COVID treatments. This is a key as well, as the COVID treatments are available and that it's not all about just prevention. So a lot of positive, hopeful news going forward, but the fight is not over. And if we've learned anything from June and July, it's don't call this over till it is. We can't be overly optimistic, unfortunately, or most importantly, we can't be overconfident. We have to keep testing and fighting. So if we go to the next slide, let's talk about the tide has turned. And again, now for the better. If you can see this chart, you could see the different spikes where we got up to in the winter period on the top of the chart in red, 250,000 people were told on a single day that they had COVID. We got pretty close to that, but happily not all the way. We had about 175 days, but closer to 150 average. And as you can see to this chart, the numbers are going down. Deaths, however, have usually roughly, it used to be a 2-week, it's now closer to a 4-week lag because we are able to better take care of people, but in no way is this over. What I find interesting is look at the death rate. And you could see the death rate go from that early piece of 7% where things were crazy down to 1.3%. Between 7 and 1.8, clearly we understood there were more people. Between 1.8 and 3 was all about better care. Why hasn't it gone further down? Sadly, it's because of the unvaccinated and Delta. Delta tends to have a higher viral load, a faster infection rate, and the unvaccinated are getting sicker and sicker. So we have not reduced the death rate. I hope it will in the future. If you want to know, how does this compare to flu? The flu is still 1/10 this rate. It's 0.14%. And that's the worst flu season ever. The regular flu season is 0.08%, not even at 1%, not even at 1/10 of 1%, 0.008. It's at less than 1/10 of 1%. So while for many this feels like the flu, not for everyone. Next slide. So why is this happening? We know that it's all about Delta. And I thought you would appreciate seeing an update here. In July, Delta had dominated. It had become dominant in just 1 month when Alpha was dominant in 3 months. But you can see from here, it is now literally 99.9% of US cases. It is unfortunately very well established and very efficient. Not since the very first weeks of the pandemic have we seen one variant account for so many cases. But when you think about that Delta variant, and we can go to the next slide, you can see that's why vaccination is so important. And these are tremendously different numbers since where we were in July. I wanted to give you when people were first eligible. Clearly, the older adults were eligible in January. The younger were eligible in March and May, and everyone else in between. You can say vaccination rates have indeed gone up. For the oldest Americans, 65 to 74, we're at 97%. I don't know that it's going to get a whole lot better than that. And you can see the blue is fully vaccinated and the orange is 1 dose only. And you could see that with the 17 to 12-year-olds here, I average this at about 60%. So it's slower than it really should be, but we are making real progress. So does vaccination work? I hope none of you are reading the misinformation, but let me give you some information. This is from the McMurrow presentation, but the CDC and Israel, UK, Germany, every country that has looked at this has had virtually identical numbers. The vaccine works. Against disease incidence, it's, quote, only an 8-fold reduction. That's why you're hearing about so many breakthrough cases. So I have heard people say, if there's going to be a breakthrough, why do I need to get vaccinated? Well, 8-fold is useful, but take a look at the next two. Hospitalization and death, 25-fold reduction. So if you're talking numbers, you don't want this bad lottery ticket for which you're 25 times more likely to get it if you don't get vaccinated. Now we're talking flu-like numbers. For the vaccinated, this is becoming like the flu. Not quite there yet, but very close. For the unvaccinated, it is nothing like that. And for those worried about vaccines, I don't want to be too preachy, but a lot of people have had these vaccines for a long time now. I understand the fear at the beginning, but not now. Next slide. So if we take that, let's take a look at mitigation. And what are the various mitigation strategies? We talked about vaccination. Now we're going to talk about mitigation and then move to testing. On mitigation strategies, I think about the top three kind of are obvious. There's nobody protesting over hand washing or cleaning the building and cleaning a classroom. But the last ones are tricky. I'm going to talk and focus on the masking, but just for a moment, physical distancing, realistically, quite frankly, is not happening. I would say in the vast majority of schools. Surveillance and monitoring through testing, we're going to focus on that in a minute, but let's look at masking first. Unfortunately, one of the most controversial. So where are we in terms of controversy with masks? This is a map of the country, and as you can see on the right, the legend. In the orange states, they had mask mandates, but the mask mandates were overturned. So governors were not able to say you can't put in a mask mandate. What has happened in those states for the most part, there's still some legal challenges, but right now in all the orange states, individual schools or districts or communities can put in a mask mandate. For the most part, I would say and guess it's not all of the schools by any means, but schools that want to do this can do it, which I personally think is a good thing, but many of you may think differently. The 30% in the light green is no mask mandate. These states are saying you do what you think is right for your community. 2.7% now, just 2 states have had mask mandates banned. So in those 2 states, they cannot go forward and they cannot issue a mask mandate. I think it's now I'm going to embarrass myself. I think it's Oklahoma and Utah. I know it's Oklahoma. So don't hate me, but send me those notes as to what I got wrong. And then in 42% of the states, they do have mask mandates. So what does that mean and why are these important? Well, the CDC has recommended universal indoor masking for students, teachers, visitors, regardless of vaccination status. Yes, this changed. This was done in August. Initially, they said if you're vaccinated, you don't need to get masks, but we have a lot of vulnerable children. And I know a tremendous sensitivity for teachers who are with kids all day long, really respecting their rights and making sure everyone's masked. So, and next slide, why is this important? Well, the beginning of the year was really challenging. There were more than 2,000 school closures across 45 states. So 45 out of 50, the Dakotas, testing my geography, the Dakotas were not included in that, but virtually every state had some school closures. So what we really want to do, and we talked about it last year, open schools and keep them open. The good news, as we'll see on the next slide, is with those school closures, they peaked at the end of August. Those schools that began in the beginning of August were really challenged, but happily, we're just talking a handful of schools that are closing now. So that is key. So why and how are these schools staying open? It's number 3 on this list. It's all about testing. So the first new thing that I haven't talked about a lot since the summer, but it's critical, is a new program, newish program called Test to Stay. And let me explain this chart. It's from a clinical trial done in England, in the UK, with 162 high schools. And if you look on the left, there's a control group, 76 high schools, and on the right, an intervention group. Now, what happened in all of these places is somebody got sick in a classroom, in a cohort, in a group of students. And the control group is the standard. They would send everyone home. So in those 76 schools, every time they had a positive case, they sent everybody home. In the green group, they said, no, we're not going to send everybody home. What we're going to do is test everybody for 5 days, day after day after day, in this case with a daily antigen test. And what we found was, I won't go through the boring statistics, is that for students, 40% fewer days were lost. For staff, 61% fewer days were lost. This is a really, really big deal. Did it stop the outbreak entirely? It did not. But it meant that people who legitimately needed to stay home did, and people who didn't could go back to school and school could stay open. So this was in the UK many months ago. What's happening in the US? On the next slide, what you'll see is these are the states and some communities that have tests to stay. They're not all of them. I'm sure there are more, but these are the ones that are doing it in a semi-official manner. You may have seen in the press an article about this, and the CDC said they're reviewing it. But these are the states that are aggressively using tests to stay. What I've heard is that parents like this, even if they don't like traditional testing every week, if they know there's an outbreak, they feel like very comfortable saying, okay, there was an outbreak, you can test my kid for 5 days. Some of the states, I believe Illinois is test on day 1, 3, 5, and 7. Some of the others are 5 days in a row, but it's almost always 3 to 5 tests to make sure your kid wasn't exposed, or the teacher wasn't exposed, and then they can go back to school. Next slide. So we went through the mitigation strategies. Let's go back over them. With a focus now, I see it as testing. We have to do the top stuff in green. We probably can't do the physical distancing. Masks, we know how controversial it is. So testing could be a very, very strong way to go. So I'm assuming many of you believe that given what you're doing, but let me give more context here. We'll go to the next slide to say, do we believe testing will work? Well, this was a mathematical model after looking at 100 or more schools that the RAND Foundation with Mathematica, supported by Rockefeller, created. Mathematica did most of the work, creating a model that says, regardless of where your COVID numbers are, regular testing reduces in-school infections by 5%. 50%, oh my God. But when I think about 5%, I remember that number because the good news is that many, many kids, despite the fact that COVID is in their classroom for reasons that we don't fully understand, it appears as if they are less likely to catch it from others, and that they have a likelihood of getting COVID even in the same classroom as 5% or lower. But let's go to the next slide. So if that's the mathematical modeling, what's the actual data? Well, New York City, 0.5 positivity in the K through 12 schools. New York City in the community, 10 times higher. Colorado, positivity, in this case, it was around teachers, positivity around adults in the state, almost 10 times higher. El Paso, Texas, during its recent surge, the schools never closed. They were at 1% positive. El Paso, 10% positive. So schools have a lower rate, which is great. We want to keep kids in school with their teachers being happy, but it still makes sense to test. But it's good news that the numbers are lower. Next slide. So how do you start a program? These are the considerations you need to be thinking about. How does the school think about testing? What accuracy is acceptable? And the reason I say that, as I'm sure you know, in the next slide we'll talk about, is the difference between antigen and PCR test. Both can be used. but you have to think about how your school wants to create a process to do that. And I'm happy to answer any questions. The daily testing volume, how many students and staff are you testing? How often? Once a week is most common. Very, very few schools are doing twice a week today. And how will you take that and figure out how to minimize cost and make sure that it's appropriately paid for? How soon do you need results? For the people that we're working with as part of the NTAP program, which you'll see, you should be getting results within 24 hours. So nobody should have to wonder the day after their tests are taken. If you're taking them on Tuesday morning, you should get the results before kids go to school on Wednesday. And then lastly, what resources do you need? When I talk about the money, the good news is much of this money can be used for staffing, and that's key. But what resources do you need depending on how you set up your program? So next slide. I talked about PCR versus antigen, and I feel like I could write a book about this and people arguing about which one is better. I do a newsletter. If any of you want it, let me know. But I talked about the fact that let's empower each other. Let's create power with information. Testing gives you that power. Testing gives you that information. It doesn't matter if it's a PCR or antigen test. They both work well, but they are slightly different, and I'm going to explain that. But either test is better than no test at all. So what is the way to think about it? Well, if you have a tiny amount of virus, then a PCR test is more likely to pick up that virus than an antigen test. But it typically takes a day to get back to you. The antigen test will pick up the virus, but typically only takes 10 minutes to get back to you or 15 minutes to get back to you. But it tells you whether it's transmissible. We don't know exactly where this line crosses, but we know at some point you might have a test down here where PCR would be positive and the antigen would be negative, but the likelihood of that person being transmissible is very, very low. So it's important to recognize that we need to know the difference between those two. If people have other questions about this, I've got a strange analogy that we could talk about. So I think it's important to recognize that difference between the two tests. Why is this critical? Regardless of which test you use, this is a very sneaky disease. And in a Seattle study, they found that 38% of the kids, which is the average I use for adults, had no symptoms at all. They were running around, they were perfectly healthy, no cough, no tiredness, and they still had a disease. Similar to adults, I had this, my 91-year-old mom had COVID and probably gave it to others early in the pandemic when we didn't fully recognize it. So it's not just kids, it's adults too, which is why testing is so important. Next slide. So where do you get the money for this testing? Let's talk about that. There are 3 different systems. There used to be 4, but one is closed. I'm going to start on the right, ESSER funds. Those are the educational secondary school educational resource, ESSER. You probably know more than I do. I see some of you smiling in your photos. But these are the broad education related issues. The federal government allows it to be used in testing, but the majority of these funds have not gone to testing. They really have gone to everything from ventilation to computers to Wi-Fi and otherwise. So the 2 key programs are here in the middle. The coordination hubs, which is Operation ET, that's about $650. There are 4 providers around the nation, East, South, West, and kind of Midwest. And it's a great program. Schools don't have to put out money. The testing is done free. The downside of it is they decide what tests they use, and each part of the country is slightly different. So it's not about you don't get to choose. If you're in one region, you have to do the testing that comes with this program in the region. Then, but you don't have to deal with anybody else. You deal directly with the federal system. The other program is the ELC program, part of CDC. And I've worked with many of the providers here called NTAP, the National Testing Action Program. And they're also K through 12, public and private and charter schools, according to the federal government. It's $10 billion, but the money went to states. So if we look at the next slide, if you haven't seen this before, public information, you could see how much your state gets. It's also islands like Puerto Rico and US Virgin Islands also have money under this program. And there are 5 cities, New York, LA, Chicago, Houston, and Philadelphia, that get money separate from their state. So this money is available till July of 2022, but each state has its own program. Most of them follow the federal guidelines, so I'm going to share the federal guidelines. And then you need to work with each state to understand how you can coordinate with them to provide testing for the schools in your area. So if we go to the next slide, you can see this on a map. It's similar, the data on the map itself is similar to what I just went through. But if you want to know, how can you use the money? 85% has been the test itself, the PPE, the test kits, direct money, including staffing. 15% is, you can consider it overhead, coordination, management, education, monitoring, data collection, and reporting. So that goes in the 15%. But what's new since the summer is, as of August 10th, these monies can be used to be testing one's family and community. And that's a really big deal. I've heard this a lot from parent groups, where the parent groups have said, you know what, this is going to hurt my kid. I'm not comfortable. My kid's too young. They can't self-swab. I don't want anyone else touching them. What has worked very well is the schools inviting the parents in, and they can watch, or they can get tested at the same time. So the federal government has allowed that. Again, each state has to make its own decision, but I've heard most of them will go by these rules. Some states will only have, you probably know this, but some states will have one vendor, but most of the states will have multiple vendors. So if we go to the next slide, I will summarize and go through this. And then maybe, Lindsay, we could stop here, given the recording, and take questions now, and then go to Karen. Does that make sense? I see Karen nodding.
Yes,
So
that works for me.
Great. If I summarize 4 pieces, no vaccine is 100% effective. I will say, of all the vaccines in the world, this is as close as it gets, but it's not 100%. And there are breakthrough cases. Number 2, we don't know how long they last, probably 6 months. Not everyone will be vaccinated for all sorts of reasons. And the mutations like Delta definitely impact the vaccines. So testing is essential to help avoid outbreaks. Will it avoid all of them? Maybe not. Will it avoid a huge percent of them? We know from modeling at least 50%, yes, and potentially more. And it's easy to do. And I see no reason why virtually every school in the country can't get it done for free. Well, no free lunch, but from the federal and state dollars that are there, because it's a whole lot more expensive to treat people than it is to do regular testing. So happy to take any questions.
Gang, you can pop them in the chat, and if you want to make your questions anonymous, feel free to just text them directly in the chat to me, and I can read them out loud without identifying you.
There's got to be a few questions. It wasn't that clear, was it?
All right, I think we just all enjoy hearing from you now. So.
Oh, it's really an honor, and thank you for all that you do. Let me take a couple. Let me answer a couple of questions. Oh, right, there's a question there. As you're reading that,
Yeah.
Okay. I'll go with these questions. Lindsay, is it okay if I read them?
Absolutely.
Any resistance from state and governments using funding for this purpose? Well, yes and no is the answer to that. There are a few states that are objecting. I live in one of them where the governor wanted to use the federal dollars to actually give vouchers to any school district that had a mask mandate. The federal government said, nope, this is not for that. So if we go back a slide, you could see this money has to be used that way, period. It can't be used any other ways. It can't be used for pro-mask mandate or anti-mask mandate. It has to be used in these ways. So that's the federal piece, but there are some states pushing back. There are 2 states, I believe Idaho and Iowa, who didn't accept the money, at least at the beginning. Maybe that's changed. And they have said, we're not going to test. Whether that's, oh yeah, I see Brett saying that. I have a quick question about funding. Brett, I don't know if you want to go off mute and you say that.
Yep, I can do that. So we discussed this with Lindsay briefly last week. I think Lena got more of that discussion than I did, so maybe this has been somewhat answered, but yeah, so we are one of the 2 states that did not accept that funding. So I presume we will be directing people to the other avenues of funding. So I was just wondering if there's anything I need to know about that, anything specific I should be telling partners about that funding.
No, well, yes and no. I can get you the name if you don't have it. I believe in Iowa, the company is Battelle that is covering Iowa. And Brett, I can put my email in the chat and you can send me a note and I'm happy to get back to you. But I believe it's Battelle and you speak to them or the school district speak to them and they can then arrange testing. If for any reason there's a problem, I can get you to the national coordinator. He's very happy to take calls. And part of the reason that was set up, as I understand, is areas that for whatever reason, it's hard to get state money, and Iowa, I think, is a great example of that. So I hope that's helpful.
Okay, that definitely is helpful. Yeah, if you could just put your email in the chat, I'll send any questions I have there. And this may have been on the slide. I can go back and check, but how do you spell that? Battelle.
Battelle.
Okay, great.
And while we're talking, I may be able to, as Karen's talking, I may be able to just quickly get the Battelle person contact name. And again, if you have any problems, let me know, or I'll get you the national contact coordinator.
Okay, that would be fantastic. Thank you.
Other questions? I'll let Karen take the Thermo question in a minute. This is something we can share with the schools, part of our outreach? Absolutely, you can share this with your schools as part of your outreach. I would also, in addition to the Ready, Set, Go site, which Karen will talk about, you can go to openandsafeschools.org. It doesn't have this exact presentation, but pretty close, and I'm happy to send any materials to all of you. And I think Lindsay's going to coordinate that with Brianna.
Yep. So, you know, you guys have gotten a lot of tools already, and we added a bunch more in the last couple of weeks, including an FAQ in Spanish for Spanish-speaking parents and adults of kids, and a few other shareable images that you can use, and a few things that are really targeting parents of students. So that is something you can take a peek at in the Dropbox. And then you will also get this recording. We'll make it, the entire thing will make available for everybody just to watch, but we will crop to just Mara's presentation. Hi, future me cropping that. We will crop just Mara's presentation, and that can be used as the video that you share at the $1,000 level of funding, or you can also put this at the beginning of your, at the $4,000 level, the beginning of your forums that you're doing, whether they are in person or virtual. You can just share this, and it's as up to date as we got right now. So that's an easy way to get some of your requirements out.
So I think I answered all the questions in the chat for me, unless Lindsay, do you have any others?
No, I think we've been pretty good here so far, but I think it's probably time for Karen to step in and discuss who at Thermo Fisher is available. So Mara, thanks so much for bringing your expertise to us again. At this point, you're at least an honorary affiliate, I would say. So.
Honored.
All right, so I see Aaron's question here for Karen, good rhyme, specifically saying that school districts in New York are getting ready for testing as we do outreach. Is there somebody specific at Thermo Fisher they can reach out to when they have questions?
Yes, absolutely. I will put an email also into the chat. I am running the presentation, so as soon as I finish up running the presentation slides, and you can reach out directly and somebody get back to you in less than 24 hours.
Awesome, thank you.
Excellent. So that's actually a great segue into my section. Thank you so much, Mara. Like, your data is always amazing, and I feel like I always learn something every time I hear you present it. So thank you. We're going to shift gears just a little bit and start to talk about the Ready, Check, Go program. And the Ready, Check, Go program is a testing program that has been put together with Thermo Fisher in conjunction with Color Health to actually be able to provide testing options for schools so that they can get testing implemented and put into place. And it's a single, very simplified process for the schools so they can really focus on teaching kids and kids continue to learn. So my name is Karen Cormier. I'm a senior marketing manager in our clinical testing group at Thermo Fisher Scientific, and I've been leading up the Ready, Check, Go program since we started working on K-12 testing and partnering with people like Mara, who have been doing great work in really introducing testing into the school space. So Mara touched on a little bit about some of the key considerations around testing when we're talking about K-12 schools. I'm going to go just take that one step further down into some of those requirements and some of the information, in us working with different schools across the U.S. that we found to be very helpful to take into consideration prior to bringing a program in. First of all, effective testing programs should really empower teachers and schools to really just focus on education. They need to be able to provide healthy learning environments for students and really make sure that our teachers and administrators are focused on the children and focused on learning and not having to focus on testing and science and finding labs to process samples. And we really want to maximize in-person learning, meaning that it can't take a really long time to get testing completed where kids are in line for multiple minutes to hours to try to get everybody tested because it's just not scalable and just not sustainable for a school. So what we've done is we've created the Ready, Check, Go program, which really provides an opportunity for schools to bring in a program that's extremely easy to implement, that has a software backbone that really manages all of those processes to administer a program on a school campus. So very simplified software to be able to get parents and students and staff registered, to be able to participate in training, in testing, be able to drive the appropriate HIPAA compliant consent, and being able to report out results in a way that are meaningful both for the schools, for the public health departments, and for the parents and students. Our program is PCR based, but we also offer antigen testing as well. So really a flexible set of solutions that schools can choose from to really make the most appropriate decisions for the type of testing that needs to be done, as Mara alluded to in her presentation, whether that is in trying to keep COVID out completely by trying to find it as early as possible upon infection, or really trying to look for those that are more on the symptomatic side or a little bit later in their exposure through antigen testing. So this is really just to demonstrate, how the program works from the perspective of keeping teachers and administrators focused on the children, focused on learning, keeping kids in the classroom, where we, through our partnership with Color Health and the testing providers, partner together to be able to really take that burden off of the schools and make sure that we sort of handle all the rest. So once again, our educators can continue to educate kids and not have to be scientists as well to run samples or figure out who the most appropriate providers are to be able to run the appropriate type of testing for their school. So it's very simple and seamless. We have multiple language consent forms. We provide all the testing kits. We provide training and support 24/7 for any of the schools that are bringing our program on board. And once again, we really want to keep this as simple as possible for schools so that they don't have to dedicate their staff full time to be able to administer a program or collect samples and report out results. So truly light touch, very simplified, but meets all of the requirements at the state and federal levels to be able to put the appropriate testing in place and reporting. So since we started Ready Check Go, we have actually had multiple schools, districts, and states bring Ready Check Go on, and I just wanted to highlight a few of them. So we are providing testing now in the Chicago Public School District. There are 516 schools that are currently on board and testing using Ready Check Go. And we've also been one of the providers that have been awarded the state of Texas. There are multiple providers within that state, but we are one of them. And we've engaged with over 95 districts across the state of Texas, from very, very small districts up into some of the largest that represent about 11 million students and staff. So we're definitely very proud to be able to provide school testing to many districts across the U.S. We also, very much value the feedback from our customers as well. So you can see a quote down here on the bottom where, it is a little bit confusing sometimes for schools, and it's a very different set of scenarios that they're having to think through around testing, and being able to bring a program on board that's really kind of like soup to nuts, implementation all the way through reporting has been proven to be very helpful for them to get up and running very quickly and easily, and being able to maintain their programs with a minimal amount of effort. So I just wanted to give you a little bit of an overview of what Ready Check Go is. We hadn't really touched on that in our previous meetings, but wanted to also let you know that there are some new literature that's available to all the affiliates, which is more in line with testing overall, a little less focused on the Ready Check Go program, but really just demonstrating that true need for testing and why it's still so important, in a very easy to read infographic that can be used for administrators or parents or even people that are in local and state governments. We have an FAQ for families. We know this is a confusing time. There's lots of different information out there for parents when they're trying to make the decision, should their children, be tested in their schools. So this answers some of the highest level questions that they may have around testing their kids in a school environment. We've also found that parents who have made up their mind really want to advocate for being able to bring testing into their schools if it's not currently available. So we have a template that parents can use that outlines some of the key data around the importance of testing that they can then copy and paste into their own email and either add their information to it or send it directly as is to their school administrators to be able to advocate for bringing testing in to their school and to their campuses. Similarly, we pulled out some of the information that you either saw in Mara's presentation today or previous data that's been available in different studies, and sort of distilled it down into a quick one-pager that can be used with parents or with administrators once again to talk about some of the important data around Delta variants and some of the confidence that you can get from having testing programs available in a school setting. And with that, just a quick reminder, we've actually already provided some materials as well in about the July timeframe. These new materials can be blended in seamlessly with the materials that have already been provided, such as the importance of testing letter, the articles around school testing, the mutations and the net effect on the school system, the NTAP flyer sort of summarizing down those NTAP guidelines so that it makes it a little bit more simplified and easier to read for those that you're passing them on to. And then similarly to the FAQ for parents, the FAQ for the schools as well, since we know that they have questions as well about how and where and when to implement testing programs. I also just wanted to be able to let you know about some of the assets from social media and that are available as digital format. So we have a landing page or a website that can be visited, which is the Ready Check Go webpage, which really outlines the Ready Check Go program. So if you're talking about PCR testing, it'd be great to be able to mention the Ready Check Go program or the Thermo Fisher testing program. You can find out all the information about that program on this landing page. Lots of resources and webinars to be able to help you gain a better understanding. Similarly, in the middle, you'll find a page that's specific for parents. This is broken into two sections. One around the importance of testing and advocating for those that want to be able to sign their children up in an area where they already have testing available. And secondarily, I mentioned the parent advocacy letter at the bottom of the page. Parents can actually download that template there so that they can utilize that to advocate for testing to be added to their school if it's not currently available. We've provided a few social assets and images, as you can see here on the right, to make available for all of you. And those assets actually lead back and into these pages. So, so a very simple and easy way to be able to share some of this information. And with that, I'll pause for questions. Thank you.